The CheckMate 214 trial was a phase 3 randomized trial that led to approval of Ipilimumab and Nivolumab for first-line treatment of renal cell carcinoma of the clear cell type. This trial randomized patients to either Ipilimumab and Nivolumab, a combination immunotherapy, versus the prior standard of care, which was sunitinib. And this trial really established combination immunotherapy by showing overall survival benefit compared to sunitinib, which is ongoing after many, many years. What we don't know from CheckMate 214 is whether we can find out with a blood test who are the patients that are going to have a fantastic response to immunotherapy and who are the patients who are not going to have a good response. We know from prior studies that KIM-1, which is a protein that's shed from kidney cancer cells, is detectable in the blood and is a biomarker for kidney cancer. We showed in a prior trial that KIM-1 levels among a small number of patients decrease after immunotherapy, and that decrease is associated with better response. So we really wanted to confirm these findings in a much larger trial. Therefore, we did a post-hoc biomarker analysis of CheckMate 214. We analyzed 821 patients, which was 75% of the entire trial, and we measured KIM-1 levels at baseline and at 3 weeks after a single dose of treatment. At the baseline samples, we showed that KIM-1 is prognostic. Higher KIM-1 at baseline was associated with worse survival, and this actually outperformed the IMDC clinical risk score. What was more exciting to me was that we showed that a 3-week change in KIM-1 really quite closely predicted the patient's overall response to immunotherapy. For example, a third of patients had a 30% decrease in KIM-1 at 3 weeks, and those patients had a progression-free survival of 71 months. In contrast, the patients who had a 30% increase in KIM-1 at just 3 weeks had a progression-free survival of only 4 months. This really suggests that blood-based biomarkers can give us an early signal of how someone's going to do on treatment, and it raises the question of whether we can do better for the patients who don't have that great KIM-1 response. This data was really a team effort involving many different labs, including the Bonventry lab at Brigham and Women's Hospital, Dr. McDermott's lab at Beth Israel Deaconess Medical Center, and support from Bristol Myers Squibb, who sponsored the CheckMate 214 trial.